Hello, my name is Amber David. I'm a student physical therapist with the University of St. Augustine. The research that I am appraising is done by Grassis, Esquanzi, Brashear et al. It's the efficacy and safety of abobotulinumtoxinA in spastic lower limb. It's a randomized control trial and extension that was done in 2017. The research study was done as a double-blind randomized control trial. The initial lower limb injection of the Botox was 1,000 U and the initial placebo was 1,500 U. They were both injected into the gastroc and soleus complex along with at least one other muscle in the lower limb, which could include the tibialis anterior, the hamstrings, or the hip adductors. This was then followed up by an open label study add-on, and those following injections included no more than 4 label cycles of 1,000 or 1,500 with at least 12 weeks between each additional cycle. And overall, it was a 1-year study. The primary results for this research were evaluated using a few different outcome measures, including the modified Ashworth scale of the gastroc and soleus musculature, the physician global assessment known as the PGA, the comfortable barefoot walking speed test using the 10-meter walk test, and the quality of life self-reported questionnaire. The primary outcome results concentrated on the tone and spasticity of the lower limb and ambulation. Change was noted in both spasticity and ambulation 4 weeks and then again 12 weeks after the initial single dose injection, and this was in the Botox group. However, the results of the first injection alone did not show significant improvements in ambulation. For the modified Ashworth scale, there was decreased muscle tone that was measured at the 4 and the 12 weeks with a p-value of 0.009 and 0.03 respectively that were both of significance when the 1,500 U dosage was used. For the PGA, this result showed an improvement when compared to the placebo. However, it should be further analyzed for its significance because it only showed a significant p-value when done with non-parametric analysis. For the comfortable barefoot walking speed using the 10-meter walk test, improvements were not seen until much further on in the cycles at roughly 12 weeks. 25% of the participants did end up seeing an increase in their walking speed, and 16% of participants were classified at a walking speed that would be considered a community ambulator, which was 0.8 meters per second. For further results, roughly 1/4, from 15 to 32% of the participants no longer required additional Botox injections by the final cycle. There was also an increase in ankle dorsiflexion and decreased tone. After the 3rd round of the Botox injections during the open label, the patient's spasticity and the range of motion that they had gained had leveled off and there was no further increases. However, there was more progress that continued to occur with walking speed and subjective reports with the quality of life questionnaire after that 3rd round of Botox. And there were some participants who experienced adverse effects during the trial. However, with further research, it was deemed that they were not directly related to the treatment interventions, and those who participated had safe results. For clinical application, overall the study was very strong in the fact that it was a double-blind control study initially. However, the open label second portion was not. Nevertheless, the results of this trial demonstrated the success of Botox injections to the lower body segments for reduction in spasticity and to improve ambulation for unilateral chronic stroke and spasticity. This study also determined that the sooner a patient who has had a stroke can receive Botox injections, the better likelihood of them achieving the improved function that was reported with this result. Therefore, it is critical and crucial for physical therapists to work in constant communication with the dermatologist and the referring physician to have of the injections and physical therapy working in combination for the overall treatment and the best quality of life and care for the patient. Thank you very much. Bye.